is Facebook and YouTube.
Right. Yeah, go ahead.
Good. So a pleasant good evening to everyone. Yours truly, Dr. Jason Batson, the Senior Medical Director of Batson and Associates. Of course, joined this afternoon with none other than one of our senior consultants, Miss Karishma Ramdhan. Karishma, how are you doing?
Good. Nice to be here.
Yes, wonderful. Nice to have you.
Yes.
Keep in mind we are live on our social media platforms. We are Batson and Associates Limited on Facebook. On Instagram, we are Batson and Associates TT. And of course, so, we have a number of topics for discussion this evening. Keep in mind that it is a question and answer session. So, of course, we have Ms. Ramdhan here with us. So, a lot of because we at Batson Associates, being an organization of trained consultants, continue to deal with a lot of women who have serious problems associated with hormonal imbalance. We actually dedicated a whole series to that,
Yes.
Taking place every Monday night. So tomorrow evening, we actually will be discussing that, dealing with hormonal disruption in women. Of course, today's program, we're going to be touching on some previous questions that we would have gotten before, stuff associated with poor circulation, stuff associated with diabetes, hypertension, and of course, what we at Batson Associates offer. We have a number of specials that we're having this month. Of course, the Nerve Restore,
Yes.
very good product that deals a lot with sleep, depression, anxiety. So we're going to be touching a bit on that. Keep in mind we are live on our social media platform, so we like you to follow the page, share us, and of course, like us, allow persons to really get the Batson Associates experience. So keep in mind we are live on our social media platforms. We are Batson Associates Limited on Facebook. On Instagram, we are Batson Associates TT. And on YouTube, we are Batson Associates Trinidad. Joined with Ms. Karishma Ramdhan, one of the senior blood microscopists and consultants at Batson Associates. Of course, a pleasant good evening to Miss Kamala Samaru. She says a pleasant good night, Dr. Batson and Ms. Ramdhan. So, of course, we discussing health. Ms. Ramdhan, we know a number of the products that we carry at Batson Associates, a lot of persons continue to get really good results.
Yes.
We also know this month we actually have some specials that we're bringing back,
Yes.
as regards to the senior citizens, as well as that package with the blood and scan. So again, maybe you could just share with the public and highlight, that pensioner special, as well as, that package that we're offering with the live blood analysis, dry blood, that magnetic resonance analysis, and of course that food detox package.
Yes, so for this entire month of July, we had that special running where our senior citizens would be able to have that MRA scan done free. Normally, the pension package would consist of your live and dry blood analysis together with your consultation, blood sugar testings. But now you're able to get the scan for no cost. So you're getting the full entire package. So all our senior citizens, we have that running for the month of July. So we still have about a week again to go. So you can take advantage of that. We had a great turnout with that as we did it before for that senior citizen day. We had a lot of people came out and had their scans done free, and they was really impressed and appreciative of doing that scan, because not everybody could basically come and have this scan done, maybe due to finances, so they was basically really happy to come and have that done. I'll just touch a little bit on the testings as what basically it is being done now. The MRA scan, MRA stands for magnetic resonance analysis. So basically, you're holding a magnetic rod in your hand, which is non-invasive, it's not painful, no radiation, nothing like that, and it's scanning the entire body. So we're gonna get readings of the brain, kidney, heart, women, endocrine system, male, prostate, and from that scan, it's able to give us key details of things that you're unaware of or things that is happening currently to help us deal with the root cause of the problem. All right, then we have the live and dry blood analysis where basically a sample of the capillary blood is taken from your finger, so it's not a large amount, and that goes under our highly powered microscope, and we're able to look at something known as biological terrain, which is the terrain of the entire, blood, and that is where we're able to look at the function of your red and white blood cells. Basically, we're looking for the shape, the size, the movement. If there's any parasites, bacteria, blood clotting, it can also pick up early signs of cardiovascular disease, cancer, hormonal imbalance, you name it. Those testings would be able to give us our foundation in helping you correct your problem. Whatever problem you may have or issues, those testings confirm the root cause, because most of the time you may have an ailment and that is basically not exactly what is going on. So for example, you may suffering from high blood pressure as a result of getting pain behind your neck or dizziness. Sometimes it's not only that, it's a greater cause deep down.
Definitely, and as you so rightfully said, with that magnetic resonance analysis, you know, we have a lot of people now doing that. There are a lot of other organizations doing it. So, if I, let's say somebody says there's this particular set of people doing it for one price, but Batson Associates is our next price. So, what makes it different, or what is the difference between what they offer and what we offer at Batson Associates? From your perspective.
The information given, the knowledge that comes behind that test, the key details, because we've had a lot of people who would have brought that same MRA results to us. They say, well, Mr. Ramdhan, I did this before. You're recommending that I do it again. I say, yeah, there's a reason behind that, because I would like to pinpoint much more details, compare, and then our clients will say, well, this wasn't really explain to me in this manner how you are bringing it across. We heard certain things, but we here at Batson and Associates, we can boast that we go into key deep details in health.
I agree. Agree. And not only the details too, but even the treatment protocol. The treatment protocol is what makes the difference, because as you rightfully said, when you do the live nutritional blood cell analysis, and with the trained consultants that we have, you have the advantage of being able to understand the body in its entirety. Why are you suffering from hypertension? Hypertension may be the symptomology, but hypertension is not the problem.
Correct.
Right? So, it could also be secondary hypertension, which of course is caused by a primary reason. And so on and so forth. So it means that at the end of the day, doing the test is one thing, but of course the interpretation, the analysis, as you mentioned, the thought process as it relates to the details at Batson Associates is what gives us the advantage in being able to successfully help our clients effectively and efficiently. And that's what people wanted. They want to be able, when you come, we are actually able to make spot on recommendations and be able to really determine the root cause of the problem. And as a result of that, we're actually able to help more persons. So, feel free to take advantage of that. We know we in the season of holidays, so, a lot of persons, I know we have graduation. We have a lot of persons dealing with, we have book lists coming up.
New schools in
new
September.
School term, that kind of thing. So I know a lot of parents and a lot of individuals very, caught up dealing with the children and that type of thing. So that is why, we actually have some of these specials, so that you're not only able to take care of the children, but also take care of yourselves, because of how important it is. Let me say a pleasant good evening to Karel Debadine, as well as Clifton Henry. A pleasant good evening to you. So, one of the things, or one of the products that we offer at Batson Associates, of course, is the Nerve Restore, which I'm going to touch on in a little bit. Keep in mind, we are live on our social media platforms. We are Batson Associates Limited on Facebook. On YouTube, we are Batson Associates Trinidad. You're listening to Dr. Jason Batson, the Senior Medical Director. And I'm, of course, joined with the very efficient and effective consultant blood microscopist, Ms. Karishma Ramdhan. And we're discussing health from a natural and integrated perspective, Ms. Rachel Ramcharan says not only giving detailed, understandable explanations, but actually following up with the clients and ensuring results are seen and improvements are being made is what makes Batson Associates stand out from the rest.
Thank you
so very much for that very
Thank you.
that very detailed observation and explanation. And it's in fact the case, because at Batson Associates, we pride ourselves on ensuring that the client gets what the client came for.
Yes.
One of the things I often ask clients when they come to us, especially when they have to do their review, I always ask, are you satisfied? And with the majority of the time, they get a resounding yes, I am satisfied. I will recommend you to other individuals because, we really treat people from the core aspect of their issue. Very quickly, keep in mind 2 dates. One date, of course, being Sunday, the 25th of August. That's a key date. That is actually the Sunday or the day when we're having our symposium in the Shoguna's office. And that is going to be taking place on a Sunday afternoon. So we're making sure, you can actually go to church and come from church afterwards.
Yes.
We're most likely looking at anywhere between 12:30, we would begin the first session. And we go from 12:30 to 2:30, and then we go 3:30 to 5:30.
Yes.
So we'll be able to at least have 2 segments or 2 sets of persons that we will be able to facilitate. And as well, we also have the 8th of September. Now, the 8th of September is still sort of what's the word I'm looking for, boy? It's subject to change. That is the 8th of September when we plan to do our symposium for Port of Spain, but most likely that is going to be taking place at the
Red Edge Mall, St. James.
No, that's not going to be Red Edge. That's going to be up this place, up Lady Chancellor.
Oh, Lady Chancellor. Okay.
Alicia's Palace.
Correct.
So that is where we're going to be doing that one. So look out for that. I see a client is asking about Santulan and Nerve Restore. Nerve Restore we have in stock. Santulan, unfortunately, we do not have as yet. However, Santulan should very well be here before the month is out. I could safely say before the month is out, Santulan is going to be in all our offices. So we do apologize for that little. We had some serious issue with that product, but again. Being the good product that it is, a lot of persons are waiting, and as soon as we're going to ensure that everyone gets their stock and more. Ensure that we carry that a lot of our old favorites coming back, a lot of things like the circulation tea. We also have a tea known as the circulation regeneration tea, which is a very good tea. Actually, seeing that right here, and this product is actually a product that, as you'll see it, nice package, tastes really good. That was one of the key components because at Batson Associates, we try to ensure that our product actually tastes pretty acceptable now, because a lot of individuals, you find you want them to use things, and when they use it, they're actually able to feel, not only feel good, but the experience is a pleasant experience. We try to make the taste experience as pleasant as possible. Okay, guys? Keep in mind as well too that open clinic days that we have, so you do not necessarily have to have an appointment, and that actually takes place at all of our locations. In addition to that as well, keep in mind that pension package. So there are a lot of things there. We also have a special on Nerve Restore, I know.
Yes.
Nerve Restore is actually one of my favorite products. I actually used it. Did I use Nerve Restore today, boy? Yes, I did actually. And that product actually helps significantly with sleep.
Yes.
It helps with cognitive function. It helps with your memory. It helps with energy. It also helps, for women who have problems with depression and anxiety. That is actually one of the products that we highlight so much during our that segment that we'll have in tomorrow night.
Yes.
So that is where we deal with hormonal disruption, and the Nerve Restore is actually one of the products that we use for hormonal disruption.
And it's actually on special. So you can check out the Batson Associates page and you'll see the discounted prices there. We also have other protocols as well, like our circulation protocol that's also on discounted. So you could take advantage of that packages that we have. We also have for men, for prostate, inflammation, all of these things. So you can check our Batson Associates Facebook page for all the specials that we have running for that for this month and going forward. I'm sure we might extend certain things as well.
Yes.
I know that Dr. Batson will be highlighting the female disruption program tomorrow.
Mm-hmm.
But one of our starring product is the women's formula that we carry as well, which assists greatly in so many different aspects. I'm a testimony of that as well, and it's really really amazing product
Mm-hmm.
for menstrual cycle, cramping, polycystic ovaries, fibroids, endometriosis, for fertility as well. We just recently heard that we're gonna have another Batson and Associate baby on board.
Yes.
So the products is working really good, and that's where our clients, discipline and listen. They follow the procedures that we say, and they get really, really, really good results from all these products that you're seeing behind Dr. Batson. Those are some of our products that we have, and most of you will be familiarized with it because you would have used it before, and we have so much more coming on board, including our eye drops as well.
Yeah, definitely. And as you so rightfully mentioned, that we actually have products that people continue to really give rave reviews. Good grief,
Yeah.
give rave reviews. The rubber band was-
Yeah.
yeah, give rave reviews about a lot of the products that we carry.
Yes.
And Batson Associates, being a practitioner for about the past 14 years, we have so much experience with a lot of the clients
Yes.
that we carry, that we deal with rather. And diabetes continues to be an issue. We do run an integrative diabetes clinic where we need to really work on our clients. I'm seeing someone talking about the foreign clients. And of course, you can WhatsApp that number that you see up there, which is the 314-9975. So just put 868 in front of it, Miss Hazel comments. And we would be able to send that information for you as regards to what you need to get. That landing page that we have on the website also, very soon, from this week coming here,
Yes.
we'll actually be able to guide our clients as regards to certain products that we have there and to get those products. So Miss Cummings, you could always message 868-314-9975 and let the office know, and we'll take it from there. We're working very assiduously to get a lot of, because we actually have a lot of clients in the Caribbean,
Yeah.
Barbados, Jamaica, St. Vincent, actually in the process of working with a lot of those islands to get certain things done. Because I mean, the thing is, you have sick people all about the place. You have persons who want help, and as trained consultants in integrative medicine, that's actually one of the things that Batson Associates have the ability to do. Really assist our clients from an all-out perspective. Because
Yeah.
you mentioned about we having a Batson baby recently.
Yeah.
And I remember the young lady who came, and she was quite successful in being able to conceive.
Yes.
But what I admired about her is that she continued to take the guidance.
Yes.
We would call, we'll follow up. She
Yes.
make sure and stayed in touch with us.
Yes.
Because a lot of you always come to Batson Associates, get your children and don't call us.
Yeah.
And that's bad because we have to do follow-up work.
Correct.
She needed certain things for her nutritional protocol. We recommended certain things that she could use
Yes.
during pregnant that would actually make the pregnancy more successful, would make it easier on her
Yes.
to really deliver a healthy baby, boy or girl, whatever the case may be. But it's because of the adherence to the protocol, adherence to
Yes.
what we recommend. Yes, Antigua as well.
For
Wanda
sure.
is saying Antigua, definitely. So a pleasant good evening to you, Wanda. Wanda, I'm actually looking for persons in Antigua to do some work with. So I'm actually going to be reaching out to a lot of individuals, especially with that Santulan, because I know a lot of persons actually want to get Santulan. They
Yeah.
want to get the eye optics formula. They want to get the nerve restore, the inflammation
Inflammation
formula
formula.
as well, which we're working assiduously, because that product is a kind of technical product as regards to the foreign market, but we're working on it to ensure that we actually have persons who can access the products, most importantly, and of course by accessing the product, you're able to get maximum benefit, maximum results. So of course, share the live, like us, share us, and of course let individuals know as regards to what we offer at Batson Associates. Keep in mind that hormonal disruption program that is going to be taking place. That is tomorrow night. That's tomorrow. Is it from 8:30, boy? I believe it is, yes, from 8:30 to 9:30, right? And that's on a Monday night. So far we have had two programs. We had to actually shift it a bit because we actually had the Monday, I believe it was the 8th. That was good. We were supposed to have the 15th, but we ended up having it the 17th, which was the Wednesday. And then, of course, we come back now on the 22nd, which is tomorrow, please God. So look out for that. Wanda says, I have used the iOptics formula and would like to get some more ASAP. No problem, Wanda. Again, you can reach out to us on the 868-314-9975, and we will ensure that we get the necessary information for you. Miss Hazel Cummins says, greetings to all. Lovely seeing Miss Ramdhan.
Thank you.
Of course, Vidya Abdul says good evening to all in the house. Good. So Ms. Ramdhan spoke a bit on the women's formula. And, you know, she said that she herself actually got really good results with the women's formula. One of the products as well that we carry at Batson Associates, as I mentioned, is the circulation regeneration tea. Now, Ms. Ramdhan, I know you have some experience with this product and the clients. I don't know if you would like to share, you know, some of your experience as regards to what that product has the ability to do.
Sure. The circulation regeneration, as Dr. Batson was now showing a while ago, basically helps in aiding circulation. Yes, so it helps with pulmonary circulation and ischemic circulation, you know, which is pulmonary above your heart, ischemic below. It also helps with high blood pressure. Yes, it's really, really great in helping those stubborn readings of those readings of your pressure. Sometimes, you know, you might be using different medications and it still is not decreasing. This product has proven from results clients would have recorded for us from when they began using it for a period of time, and we noticed a significant decrease in those blood pressure readings. It also helps with varicose veins, spider veins. It helps with swelling as well of the feet. Also, we notice that some of our clients, their feet from the ankle part is really dark, or sometimes your feet, your face as well. You know, it's not sunburn, it's basically, you know, that circulation, darkness under your eyes or the side by your temple. Though that circulation regeneration is a really great product in dealing with that situation. And basically, it's not expensive, and you just basically take about a half teaspoon in a cup of water and you drink it, and it doesn't taste bad. You know, it has hibiscus and stuff in it, some really, really good ingredients that basically you're accustomed using. And yeah, it's really, really good.
Definitely. I second that. In fact, there's a client we have in Tobago. I mean, because she would have given us testimony already. That's Miss Sandy.
Oh yes.
Let me say a pleasant good evening to Miss Sandy. And you know, she had some serious issues, you know, and the circulation regeneration was actually one of the products that helped her because she had a serious problem with hypertension. And you know, just speaking to her this morning, she said he had the blood pressure coming down, Dr. Batson. It's coming down slowly, but surely, because she used to be getting like 180 something, 190 something, and now she's actually coming down to like 140 something, and that's being more the norm than before, where she was getting those very elevated numbers. So of course, you know, that circulation regeneration, these are really great product for those of you who have issues with high blood pressure, those of you who have problems with circulation, as Ms. Ramdhan so rightfully mentioned, things like pins and needles, cramping in your calves, burning on their feet. We also have serious challenges associated with persons who have problems with, as you mentioned, varicose veins, spider veins. A lot of persons have poor peripheral circulation. So the diabetics who have things like pins and needles, cramping in your calves, burning under your feet.
Or diabetic neuropathy, those nerves, the damages, the nerves that is damaged really bad. That helps really, really good in that.
Definitely. So, you know, feel free to give us a call or visit. Keep in mind those testing services. Keep in mind, you know, the well-qualified and experienced consultants that we have at Batson Associates. So it's not everybody try to see Dr. Batson. You know, we have specific protocols in place. Tobago, that office doing really good, coming back up nicely. We'll be in Tobago, God's willing, the end of the month into early next month. So take advantage of that. You know, ensure to call that number in Tobago to have your appointment set up. Very soon we'll be getting that Saddulan that everybody is waiting for. We really, really are excited to have that, and then other products too. For example, things like very soon we'll be getting back our cerebral formula. Our optimizer, really great product. Revitalizer, also great product as well.
Yes.
We have gotten back enzyme formula in stock. That is actually a very good product that is used for a number of different challenges, including problems with circulation, problems with fibroids, respiratory problems. I'm
Yeah.
glad you said that.
Yeah.
Really glad, because our integrative respiratory clinic is something that we're going to be pushing very shortly,
Yes.
especially at that Londonville
London.
office, which is going to be opening up very shortly, in terms of even things like our arthritis. So an integrative arthritis clinic. So many persons having serious problems with arthritis issue, problems associated with osteoporosis, things like pins and needles, cramp in their calves, burning on their feet. So that tea really helps in general, and it could assist persons who have hypertension, persons who have diabetes. So if there's two complaints that you have, and you really want to get some natural relief, natural assistance from a dietary perspective, from a circulatory perspective, definitely the circulation regeneration tea is something that you want to check out. So check out that. And that, of course, is something that our international clients could also get as well, coming out of various parts of the Caribbean, the United States, that type of thing. Okay, good. So again, those telephone numbers and locations. We are located on the first floor of Money Talks building. That's Money Talks building in Montrose, Chaguanas. We also located at Red Edge Mall. Red Edge Mall is Western Main Road, St. James. And keep in mind that symposium for Chaguanas, that is for the Chaguanas branch, that symposium, which those of you who have ever come to a symposium at Batson Associates, you will definitely be impressed, because we actually give you a live example of the blood analysis. We give you live examples of what a live blood analysis sample would look like, a dry blood analysis samples. And then based on the audience, we actually able to take samples from different individuals. So we actually get a wide cross section of samples that actually give us the opportunity to explain in detail some of what we do to those persons who are there. So it's really an eye-opening experience to help you to understand the body from its basic perspective. A lot of persons, as Ms. Ramdhan so rightfully said at the beginning of the program, it's not necessarily your arthritis giving you a problem. No. It's not really necessarily the high blood pressure or the diabetes, but really the root cause, what is going on in the body. A lot of persons, excuse me, suffer from things like what is known as leaky gut. So you actually have a poor digestive system where your body doesn't actually break down food properly.
Yes.
And because of that poor assimilation, poor digestion, you end up with so much different issues. Okay, Mr. Hayden Stewart, Mr. Hayden, Hayden Stewart says, good evening. If I'm trying to come in early August, I have limited time to stay. I want to make an appointment to see you, Dr. Batson. Should I make an appointment like a week before? I'm trying to come to Trinidad, definitely the first week in August. What you could do, Mr. Hayden, yes, I don't know which area, which office is going to be the best for you, Mr. Hayden. If it's the St. James office, if it's the Chaguanas office, if it is the Debe office, I don't know where in the country you'll be located, or even if it's the Tobago office. So, Mr. Stewart, I would always recommend Chaguanas, simply because I'm in Chaguanas more often, because Chaguanas being head office. I'm usually in St. James on a Friday, some Saturday. So if that is indeed the case, Mr. Stewart, just let the office know which location is better for you, and I will make the necessary arrangements. Okay, Hazel comment says
Puna. So basically Shagona. So you can message, even if you would like to message all now tomorrow, and we could facilitate the date.
Yeah, so you could you could WhatsApp the 314-9975, Mr. Stewart. Even now, and do that so that we put things in place because of the limited time that you're here, to ensure that you are seen and well taken care of. Okay, sir? So that number again for you, Mr. Stewart, you could WhatsApp, of course, 868-314-9975. It's just below the live there. 314-9975. Good. You're very welcome. They said he might be in Tobago.
Or you might be in Tobago when he's coming. But we can always,
we'll facilitate accordingly, man, because I am, as I say, you let us know early and in advance, and we could work to suit. Right? We live in the modern world now with a lot of persons, because it's the review that needs to be done. When your blood and scan is done, what I need to do is look at the review. And that is where I'm going to make my necessary recommendations when we look at various aspects of the gastrointestinal system, musculoskeletal system, cardiovascular, circulatory. Ms. Ramdan made a very valid point at the beginning of the conversation when she was talking about pulmonary circulation, which is circulation above your heart. And then, of course, you have systemic circulation, which is circulation below the heart. So a lot of persons suffer from poor pulmonary hypertension. And poor pulmonary hypertension is very devastating and dangerous because it is one of the main culprits of ischemic and hemorrhagic strokes. So most people who end up with brain strokes, because you could actually have a brain stroke or a heart stroke, right? A lot of people do not know that. And it depends on which part of the cardiovascular system is affected, whether it's the cerebrovascular or cardiovascular system. So you can get strokes in either of those systems. So it's very important for us to look, for example, and do our due diligence as regards to cardiovascular circulation. So definitely the circulation tea is something that you can look out for. Keep in mind as well the Alkagen water for those of you living in Trinidad. You can see the wonderful bottles up behind me here. You notice how clear and crisp and transparent the water is. And that has nothing to do with the lighter. That is what a lot of our clients experience. So many of our clients, St. James actually got water over the weekend to again replenish you guys. So those of you in St. James, we have water back in stock there, as well as Davy and Shagonas. Nicola Heard, blessings to you.
Good night to you.
I hope all is going well with you. Kerry Latchu says, hey doc, I have fibroids and have constant missing period. Would women's formula and the tablets work to regulate it? Ms. Ramdhan, you want to answer it?
Yes, definitely, Carrie. That woman's formula will help with regulating the period. But what I would suggest is that you do a consultation with us because of the fibroids. We'd like to know, if you would have done an ultrasound recently, the size, how many. It's not just the woman's formula alone will be recommended for you to use. It will do some work, but you would have a little more to do.
The protocol is going
protocol,
to be,
dietary aspects too would need to change, but definitely the woman's formula will do some just for sure.
Definitely. And as well to Kerry, if you have constant missed periods, it means you have not only hormonal imbalance, but you also have irregularity. As I mentioned, you have a fibroid. It depends on the type of fibroids because you have like 5 different types of fibroids and they're given the name based on location. So a lot of the times the intramural fibroids or the fibroids in the wall are really the most troublesome ones. So, things like your uterine formula is also a very good product. That is actually, that's actually this product here, which actually aids, it's liquid. So it's refrigerated and you normally use 1 tablespoon in an 8-ounce glass of water, first thing in the morning and last thing at night. And, depending on the size of the fibroid, it's very important that we work with you accordingly. We're going to have to see abdominal pelvic ultrasound. So as Ms. Ramdhan rightfully mentioned, really make an appointment and, let us be able to help you. Let me say a pleasant good evening to Ms. Kathleen Ishmael.
Good evening to you, darling.
Always a regular on our lives. And, always thanking you for the support and the love to help us to help more individuals, very soon, what we want persons to also take and keep in mind, those of you with like women's group, those of you will, what we actually going to do, and this was something I'm working on, is actually doing nutritional support groups through our lives and that type of thing to help persons, like for example, persons with lupus, persons with rheumatoid arthritis, a lot of these groups, diabetes. There are a lot of persons with diabetes still don't even know what to eat. They don't know how to eat. They don't know, such important, vital information that can really help you as a diabetic improve and get an overall better level and standard of health. We could always make recommendations to help you to maintain and improve your eyesight because, a lot of the complications associated with diabetics are so numerous that, a lot of the times they end up in serious problems. Okay, so take advantage of that. Miss Cindy Hoyt, always a pleasure to see you.
Good night.
She says, good night, Doc, Miss Ramdhan, and team. Happy and healthy Sunday. Same to you as well. Miss Joan Eastman, she says, good night, Dr. Batson. I'm listening. Always a pleasure to have you. So those of you in Tobago, remember, we have not forgotten Tobago. Tobago is there. The only thing we need for Tobago, you all will be getting, of course, shortly, as we get over here would be the Santulan, as
Yes.
well as your um as well as your inflammation formula. That's what I want to remember.
Yes.
Yeah, Miss Ishmael says, yeah, my dear. Yeah, sorry about that, because I know she said she still don't know how to feel when she hear that word, and that is of course lupus she referring to.
Yeah.
A lot of persons, and that's why we here now, Miss Ishmael, is to really help a lot of persons, because
Yeah.
I'm always very close to lupus patients because of the suffering that they go through. I think they are some of the most I wouldn't say ignorant, but uneducated persons as regards to health,
Yeah.
and really understanding that the said foods that they're supposed to be staying away from, that the said foods that they could actually eat foods that could actually make them sicker. And that is what a lot of those nutritional support groups going to really do,
Yeah.
in terms of providing information for various diseases, because there are certain issues that you may have that if you actually eat certain, look like coffee, for example.
Mm.
Yeah, you can't have an autoimmune disease like lupus or rheumatoid arthritis and be
Yes.
drinking coffee. That's madness. That is
No.
counterproductive.
No. Yeah.
So, of course, knowing that and being able to work with the correct diet, or understanding the correct dietary protocols, is definitely going to
True.
help you to be more successful in navigating, that disease and that issue
Yes.
there. Okay, Miss Hoyt, your favorite product, Santulan, is going to be in stock before the month is out. That's all I'm saying, my dear. So, very shortly, just a little more time again. Okay, No Name Noel says, Doc, is the woman's formula good for someone over 70? The woman's formula is going to help someone over 70 who has a PMS issue. A lot of women, as we mentioned with that Monday night, is, that hormonal disruption. So definitely women's formula is something that will help a woman who is going through PMS.
Yes.
Those of you who do not know what PMS is actually postmenopausal syndrome. So postmenopausal syndrome basically means that these women have gone through menopause, and long after menopause, they have serious hormonal disruption, problems with sleeping, problems with depression, problems with anxiety,
Yes.
problems with a number of issues associated with even panic attacks, weakness in the legs,
Yes.
hormonal disruption. Okay, so keep in mind we are live. We are live on our social media feeds. We are Batson Associates Limited on Facebook. On YouTube, we are Batson Associates Trinidad. Very soon, we'll be live on all of those platforms. We'll
Yes.
soon doing a lot more work on Instagram as well as TikTok, to really bring more awareness to those individuals. So again, it is a question and answer. We have a lot of persons on the live.
Yes.
You're listening to Dr. Jason Batson, the Senior Medical Director at Batson Associates. I have with me Ms. Karishma Ramdhan, one of our senior blood microscopists and our consultant at Batson Associates. We're discussing health from a natural and integrated perspective. Let's touch a bit on the eye optics formula. We know a lot of persons have issues with their eyes. The good thing about eye optics formula is that eye optics formula is really thank you so much, Miss Ishmael. She says, God bless you all for allowing him to use you all.
Thank you so much.
Thank you so very much. Yeah, so that eye optics formula, who does it help? Glaucoma patients, high ocular pressure in the eyes. That eye optics formula is going to help. Why? One of the things it does is actually acts as a cleanse, improves circulation, improve oxygenation in the eyes. Once you're improving oxygenation in the eyes themselves, you're going to improve eyesight.
Yeah.
A number of individuals who have serious eye problems, especially things like detached retina, you might go to the doctor, the ophthalmologist, optician, or ophthalmologist rather, and the ophthalmologist will tell you that you have maybe bleeding behind your eyes. He might tell you that you have inflammation at the back of the eyes. And those, of course, are indication of severe inflammatory eye conditions.
Yeah.
Right? So the eye optics formula is something you can use. We always try to admonish and encourage diabetics to use the eye optics formula. And the reason for that is that most diabetics, especially if you're on insulin,
Yes.
your likelihood of developing serious inflammatory conditions in the eyes is much higher. So again, it's very important to really pay attention to that eye issue and really work assiduously in doing that. So the eye optics formula is available at all of our locations, St. James, Red Edge Mall, the corner of Ramsey Mood Trace, and the SS Erie Main Road in Debe, as well as Shogunas head office. That's Money Talks building in Montrose, Shogunas, and also Tobago. So take advantage of that. Those numbers there again, 2228261. That's 2228261, as well as 3149975. Yes, Miss Ishmael, we do treat cellulitis. Cellulitis is an infection. It's like a skin condition. It's like a fungus that actually you get on your legs and that type of thing. We do treat cellulitis. And you usually find persons who are diabetic and persons who suffer from poor circulation actually end up with that situation as well. So we do treat that. In addition to that as well, keep in mind those reminders of our symposium. That symposium taking place at our Shogunas office. That's Sunday, the 25th of August, 2024, at our head office in Shogunas. That's 182 Montrose Main Road, Shogunas. So you need to register, call, and register your spot for that symposium.
There'll be a link on the page and also on all our platforms where you can just click and basically place your information in, so you have your spot, added on, so you don't miss out on another symposium again. We had one in Davie.
Excellent.
Right, they had a great turnout in Tobago as well for that long weekend, which was really, really great as well. And then we have Shogunas coming up really, really soon, and we're looking forward to having that one. All our consultants would be at present, so you all will get to meet us as well. We get to meet new clients or existing clients as well, and basically we'll be giving you a nice proper lecture. You're going to be hearing from all of us, not only Dr. Batson, and basically letting you know how best we can go about in helping you better your best and get better.
Yeah, definitely. So well said. Miss Ishmael said that she met a gentleman who has cellulitis, and he was told that there is no cure. Well, the thing is, cure is such a word that I personally don't use. I mean, simply because it has some legal connotations attached to the word. So, right, we're not going to put ourselves in unnecessary problems. But what we could say is that you can reverse that. If you understand what cellulitis is really an infection. We actually had someone who we treated for that up to, I think, like maybe about 3-4 years ago. I had a client who had it really bad. And it was a female, much older lady, and she had a lot of problems because the problem is that they gave them so many antibiotics, because what cellulitis is really an infection in the skin itself, and it affects the circulation in that particular part of the body where the problem is. So what you often find is that you'll be given a lot of antibiotics, but the antibiotics not necessarily going to fix the issue.
No.
It's just like people who have things like tuberculosis, people who have problems with breathing, like asthma, people who have sinusitis, people who have problems with pneumonia, serious respiratory problems. They often tell you that you cannot be helped with those things. But as integrative medical specialist consultants, we have not only the experience, but also the know-how and the wherewithal to really be able to assist persons with these issues. Is it the same thing as elephantitis? No. Elephantitis is a different thing. Elephantitis is actually caused by a particular, is it a parasite? Boy, no, a particular bacteria from a particular, is a fly. And that could cause problems associated with elephantitis, which is actually swelling of the leg itself. Now, the thing is, a lot of people may have poor circulation that could be confused with elephantitis. So we would have to be clear as regards to what really is the problem, what is the causative factor, what is the root cause, and then we'll actually be able to help the client. In some cases, sometimes the symptomology or the diagnosis is not important, because a lot of the times persons come to us with diagnoses, but when we really do our due diligence and do our work and look at the bloods and whatever the case may be, we will realize that they're really treating you for the wrong thing. And that has happened to a number of persons. We had persons who came to us who they told that they were diabetic, and they actually didn't have any diabetes. There were some persons that we actually dealt with that had problems associated with poor circulation in the brain. And they were told that they have problems with the eyes, but it wasn't really the eyes, it was the circulation in the brain. Okay, so I believe that anyone could be helped with most illnesses once help is sorted out early enough, and once persons really follow through on what is recommended. Ms. Ramdhan could tell you the clients who would have gotten the better results at Batson Associates is the ones who actually follow through.
Yes.
You know, just recently she was
Yes.
talking about a young lady who came and who is now she came for to have to be able to procreate because she had problems with conceiving, serious hormonal imbalance, serious issues with polycystic ovaries, and we fixed the situation. But she got the results that she needed to get because she was diligent and followed through on what was being recommended for her.
And she was never able to conceive. She tried for years.
Yes.
Right? Because she basically wasn't dealing with
the root cause of the problem. Exactly.
So there's no, and she said there's no more cysts, there's nothing. So you cannot carry a baby in an environment where it's not
conducive to growth, and development and proper development.
You have to deal with that in order for that to happen, and a lot of people don't understand that. You know, basically, it's not just about you getting pregnant. We want you to get pregnant and you carry full term, not to have any miscarriages. So that's why we basically guide our clients and say, hey, don't hold on that. Let's work on the environment first, and then. But we are all humans. Things happen. But we try our best to guide them accordingly.
Definitely, and as you so rightfully said, it's a matter of adhering. Batson Associates is an organization of trained consultants. When we tell you to do something, is because we tell you because we have experience. I remember dealing with a client, and that same thing you spoke about with the magnetic resonance analysis machine. I remember someone asked me, they look at the machine, because people look at our machine like, what I could really do. But let me tell you something, that machine is powerful, and it is even more powerful at Batson Associates based on our experience, because as I told Ms. Ramdhan, a lot of people could go and do a scan on you. Plenty of people could do it. It's not really a difficult thing. It's not rocket science. What makes the difference is one, understanding the results, interpreting the results, and doing the treatment protocol to help the client to be successful in getting over or improving whatever health situation. And that is the difference at Batson Associates. It's a matter of, really looking at the underlying root cause, really determining what is causing the problem, and most importantly, giving you the results that you need. That is important.
As you mentioned, Dr. Batson, you remember there was a time, I think it's probably a couple of years ago, you were dealing with a client you had mentioned on the live as well, who's having problems with severe headaches.
Right.
And they did like MRI, CT scan, and they wasn't finding out what was going on. And then you took the report, you said, yes, you're reading it through, but I need you to do that MRI scan. And basically it would have scanned the brain. And we were able to see that client was not getting enough blood going towards that cerebral hemisphere.
Exactly.
From that scan.
Yeah, from the scanner, and the scan showed clear. I mean, despite what the CT, the brain CT, and what the CT said that they're good enough.
They're good.
They're not seeing any problem. I remember that.
Yeah.
But that has happened on numerous occasions. And usually when we get a poor reading as it relates to the blood going to the cerebral hemisphere, anytime we get that reading poor on our scan, that client usually has a lot of problems with dizziness, lightheadedness, problems with vertigo, problems with eye issues. So it is usually a clear indicator that the client is not getting sufficient blood going to their brain.
And that's so important. A lot of people don't know. Some people readings, and I can just give you an example. Normally, the normal range is like between 143 to 210. We have clients in like 70 something, 60 something.
That's madness.
Really,
that's madness.
And they're walking around.
It means 85% of the blood not going to your brain, and that is why even the product is not here, but even the balanced circulation, which is we actually where we have to get back some more that we have to restock that. A really, really good product. What that circulation does, and even the circulation regeneration,
that will do,
because that is one of the reasons why we did this tea. This tea was done specifically to assist persons with circulation. Batson Associates does a lot of work because we deal with so many diabetics, because we deal with so many persons who have issues as it relates to pulmonary conditions, as it relates to ischemic conditions, because of being diabetic, because of being hypertensive, kidney problems. We know with hypertension, if you don't understand this, if your blood pressure is ridiculous for years, you are going to end up on renal failure or on the dialysis machine. And that's what we try our best to prevent our clients from experiencing. Let me just run through some statements. Ms.
Yeah.
Kathleen Ishmael says she hopes he reach out because he's really suffering. That's the person with the cellulitis.
Yes.
Therese Liebert says, hi, Dr. Batson. Could you please tell me if creator for chlorophyll is for cholesterol, sorry, is safe? Do you have anything for
I wonder
cholesterol?
if she's mentioning
Thank you.
Crest. I wonder if it's Cresto she's trying to. If it's a
Yeah,
medication.
Miss Liebert, just clarify
Yeah.
what you're asking about there.
If it's
Just
Crest,
clarify
yeah.
it. Okay. Miss Joan Williams wrote, she says, good night to the best doctor. Thank you so very much. Anne Leger, she says, good night to you. All God's blessings.
Good
Same to
night.
you. Miss Kathleen Ishmael says, some people are buying machines and going on Google, then set up shop with a few bottles of herb and offer help. People need to be careful. Yeah, you're right. You're so rightfully said.
Yes,
You know,
yes,
there are a
yeah.
lot of people who doing that, and it's
Yeah.
quite unfortunate, you know. I respect anyone in terms of what they do. I often tell persons, I remember someone coming here and she was like, how long are you doing this? Yeah, in that face, how long are you doing this? And I said, I'm doing this 14 years, going on 15 years. So then she was like, oh, yeah. So this is not any fly by night. We didn't just
Yes.
decide to come and say we're
No.
going to bottle thing and sell it, you know. Even though it has some people would like you to think about that, but that is not the case. Batson Associates is an organization of trained consultants, and we have an excellent track record. We have excellent products. Like everybody else, we end up in problems one or two because we live in the wonderful country of Trinidad and Tobago. Everything works.
Yes. Yeah.
So you know,
Yeah.
sometimes we have our challenges like everybody else, but as it relates to professionalism, as it relates to results, they can't beat us. As regards to the Crestor, I mean,
Yes.
Crestor, like most medications that are recommended for cholesterol, are designed to break down the cholesterol in the body. It's primarily designed to deal with the LDL, which is the low density lipoprotein, which is the dangerous one, and then you have the HDL. The thing is, what we do, there are a number of things we have for cholesterol. I often tell persons, if you are placed on cholesterol medication, then it has to be a reason why the doctor would have given you it. What you need to do, though, as well, is look at the lifestyle aspect associated with why your cholesterol that high in the first place. So it means that there most likely has to be some adjustments. You need to look at what you're doing, look at what you're eating. You have to also understand the correlation between cholesterol and heart disease. There's not really much, because you have people with very high cholesterol or very low cholesterol that have gotten deadly heart attacks. Okay, so yes, we do have a number of things for cholesterol. What I would say is that you may have to give us a check. I don't know if you came to us already. The name, I know we deal with some Liberts in Tobago, so I don't know if this is the same individual or if you ever came to Batson Associates, but definitely you need to pay attention. She said, I'm still having excruciating head pain. Doc says it's a mild case of CSF. Take a Panadol, he said. Terrible. A case of CFS. Where's CF? CSF. Just search that. We'll check it because I don't know what that acronym stands for. Well, the possibility exists that if the doctor gave you cholesterol medication and you're getting headaches and that type of thing, you say excruciating head pain, so that is serious. The possibility exists you could have some blockages. What is CSF? Okay, so cerebrospinal fluid is a group of okay, right. So okay, so she said the doctor is saying, so the possibility exists a lot of the time people actually have build up fluid in the spine that could also affect the brain. So a lot of the times you get problems with headaches or you get problems with a lot of pain in the cerebral hemisphere. We can't help in that situation. You're definitely going to have to do the blood analysis. You're going to have to do that magnetic resonance analysis scan for sure, for us to look at how that circulation is, look at the biological terrain. And I'm telling you, we will definitely be able to help you. So you could always set up an appointment. I don't know, because that is serious, That is serious. I remember we had a client who came to us who had headaches for 5 years, and she no longer has it. Really, really good results. So you know there are a number of things that we can actually help you with. Doc said I have thickening of the heart. He said it is not normal for my age. My cholesterol is not high. He said take the Crestor as a preventative. I strongly suggest you come to Batson Associates. That's the best advice I could give you, because if we continue going back and forth with what the doctor said and what the doctor didn't say, we'll never reach anyway. So let us deal with you, because If that's the advice that you're getting, where they say your cholesterol is good and they tell you to take that as a preventative,
Then no.
in my professional opinion, I do agree with that. But that's my professional
Yeah.
opinion. So I suggest if you really want help and you want to sort yourself out, reach out to Batson Associates. We have
Yes.
the telephone numbers below there. Those
Yes.
numbers, of course, are 222-8261. That's 222-8261, as well as 314. The 314-9975 number is WhatsApp, so you could WhatsApp that number. You could also keep in mind that symposium that we're having. So you could actually come to the symposium and maybe bring along someone with you. So you could actually get a first-hand look and explanation of certain things. Okay. We definitely would be safe. As I said, you could check out that symposium for Chaguanas. That's taking place on Sunday, the 25th of August, 2024, at the head office, which is 182 Montrose Main Road in Chaguanas. So feel free to give us a visit. Check out our products. The Alkagen water available at all of our offices. Santulan, guys, very shortly before the month is out, you're going to have your Santulan in your hand.
Yes.
You don't understand how happy I am. And of course, things like a nerve restore. Those of you with digestive problems, to the digestive restore. I actually had a serious little bout of acid reflux one night. It was, and I took one digestive restore and I sat up and in 5 minutes my chest stopped burning me. And I was like, nah, man, I ain't using my product, boy. It was really, really good product. So check out that digestive restore. Check out the enzyme formula nerve restore. You guys also look out for that program tomorrow, please God. That's tomorrow at 8:30. Yours truly, Dr. Batson, is going to be dealing with hormonal disruption. And that is something that we advertise. So, send it out to your friends, send it out to your peers, ladies who would have gone through menopause, who you think, if you think you're going through menopause, you think you know somebody who's going through menopause or some sort of issue associated with menopause, feel free, of course, to log on to that live, like it, share it. You can also like this live, share it. Keep in mind, we are live on our social media platforms. We are Batson Associates Limited on Facebook. On YouTube, we are Batson Associates Trinidad. Let me just allow Ms. Ramdhan to give those telephone numbers again and the locations.
Will do, yes. So we are located in Montrose Chaguanas. That's on the first floor of Money Talks building in Montrose Chaguanas. The contact for our branch is on the screen below. As you would see, it's 222-8261. You can contact that number and our staff members will guide you accordingly to the other branches, which we have in Davie, which is located at the corner of Ramsonwood Trace and the SS Erin Main Road in Davie. We're also located on the western side, which is on Western Main Road inside Red Edge Mall. And not forgetting our Tobago branch, which is located on the Triangle building in Scarborough there. And keep in mind, Dr. Batson will be in Tobago very soon. So you can take advantage, book your appointments, do your blood analysis testings before Dr. Batson comes, because he does not do blood analysis.
Repeat that again, I like how I say that. Yeah,
do your blood analysis before Dr. Batson comes, because he does not do blood analysis. He has qualified consultants to do that, and then he would review. Right, you don't want to wait until Dr. Batson gets in then to do your blood.
To know, when you cannot do your blood,
healed, already.
When you could get good, you would have already started getting good results. I mean, just recently I remember meeting a gentleman who has been coming to us for a while. I think he coming to us about 6 months now.
Yeah.
And he's like, first time I'm meeting you.
Yeah.
And I said, how are you going? And he said that he's very satisfied. He has seen so much results. So imagine if he was waiting to see me. Yeah. So trust the system. Systems work, people feel. I always tell them that. So we have a system in place. We have so many things that we do. We so much checks and balances. You have your blood, you have your scan, it's reviewed. We have senior consultants like Ms. Ramdhan, Mr. Bastamante, and so many others. Let me say a pleasant good evening to the team of all, at Batson Associates, standing. To ensure that we offer great service to you guys. Keep in mind those open clinic days where you can just walk in, but keep in mind, if you're doing the blood analysis, if you're doing the magnetic resonance analysis scan, then you need to fast at least how long? 2 hours before. Keep in mind again, for the month, we have our Christmas in July promotion. If you're coming in the office, or if you'll see at Batson Associates head office, Christmas in July. So take advantage of that. We have the special circulation promotion where you actually get a 25% discount. So it was actually $1,400. and it's now decreased to now 1100. Now we don't normally call price, but that needed, and it's there on the page, so look out for it. We also have that symposium taking place on Sunday, the 25th of August, at our location of 182 Montrose Main Road, Chaguanas. Keep in mind our Nerve Restore, which we have on special. There's a great discount on Nerve Restore for this month here. So you have a few days to take advantage of that great product, you know, to help with sleep, depression, anxiety, really relax you, really help with hormonal disruption. Our upcoming programs, Monday, so we have one tomorrow night. That's the hormonal disruption series that we're doing. That's taking place from 8:30 to 9:30. And then Thursday, it's program day where we have program from 11 to 11:30 a.m. We also have from DJ Mamu on djmamuradiott.com, and that's 2:15 to 3:15, sorry. And we also have Synergy. You know, we have actually joined the Synergy family, and we have that program with Synergy on a Thursday from 5 to 5:15 with Mr. Harvey Boris. And of course, we will be doing our symposium for the Port of Spain area. That is the tentative date is Sunday the 8th of September, Sunday the 8th of September. But of course, you'll be hearing more information where that is concerned. So it's actually 9:30, so that brings our program to an end. Always a pleasure to have you guys on. And let me say a pleasant thank you to Ms. Ramdhan for being here with me this afternoon. And thank you to all you guys, Kathleen Ishmael, all the questions, Therese Liebert, and so many other of you guys, Joan Roach, Anne Leisure, and so many more. As we always say at Batson Associates, if you think health is expensive,
try sickness.
If you think education is expensive,
try ignorance.
So take care, guys. God bless. Remember, like us, share us, and of course, call those telephone numbers 222-8261. WhatsApp us, those internationally as well, for your supplements, your products. You can WhatsApp us 868-314-9975. Take care, guys. God bless. Remember, tomorrow evening from 8:30 to 9:30, we're dealing with hormonal disruption. Tell a friend, tell a colleague. Take care, guys.
Bye-bye.